Hi friends, welcome back to UsmleTeam. Today's topic is cholestyramine. Here I will be discussing only important points for related to USMLE Step 1 examination. Today I'm going to cover topics related to pharmacology. I will be discussing about the drugs, important drugs for USMLE examination. So before starting this, I would request you to subscribe to our channel and tell your friends to subscribe. Okay, let me start with this. Cholestyramine. Um, it is a bile acid sequestrant which binds bile in the gastrointestinal tract to prevent its reabsorption. It is a strong ion exchange resin, which means that it can exchange its chloride ions with anionic bile acids in the gastrointestinal tract and bind them strongly in the resin matrix. The functional group of the anion exchange resin is a quaternary ammonium group attached to an inert styrene divinyl benzyl copolymer. Okay. Cholestyramine removes bile acids from the body by forming insoluble complexes with the bile acids in the intestine, which are then excreted in the feces. Then, when bile acids are excreted, the plasma cholesterol is converted to bile acid to normalize the bile acid levels. This conversion of cholesterol into bile acid lowers the plasma cholesterol concentration. This is how the cholestyramine acts. Okay. The other drug in this group is cholestyramine. Okay, the bile acid sequestrants such as cholestyramine are primarily used to treat the hypercholesterolemia. So as I said, the drug of choice for hypercholesterolemia, single hypercholesterolemia, I mean only cholesterol is increased, then cholestyramine is a drug of choice. But can also be used to treat the pruritus or itching that often occur during the liver failure or due to the liver's inability to eliminate the bile. Uh, Okay, cholestyramine is also used to prevent diarrhea in Crohn's disease patients who have undergone ileal resection. Terminal portion of the small bowel, that is the ileum, is where the bile acids are reabsorbed. When this section is removed, the bile acid pass into the large bowel and attracts water due to their osmotic effect, causing the diarrhea. Look at this, how it causes the diarrhea. Cholestyramine prevents this increase in the water by making the bile acids insoluble and osmotically inactive. Post-ileal resection patients should use this medication cautiously. However, because the bowel surgery heightens the occurrence of small bowel obstruction, and there are several other reports in the medical literature of cholestyramine causing bowel obstruction. Cholestyramine is also used in the control of a diarrhea form of irritable bowel syndrome, as well as in the treatment of post cholecystectomy syndrome chronic diarrhea. Cholestyramine is also useful in treating post vagotomy diarrhea. Cholestyramine can also be used in the treatment of Clostridium difficile infection in order to absorb the toxins A and B and reduce the diarrhea and other symptoms that these toxins cause. However, because it is not an anti-infective, it is used in the concert with vancomycin. The side effects are the following side effects have been noted. Most frequent is a constipation, seldom both tooth discoloration, tooth enamel erosion, premature tooth decay, all from prolonged oral exposure to the suspension, increased risk of for gallstones due to increased cholesterol concentration of bile, increased plasma triglycerides. Patients with hypothyroidism, diabetes, nephrotic syndrome, dysproteinemia, obstructive liver disease, kidney disease, alcoholism should consult their doctor before taking this medication. Other drugs should be taken at least 1 hour before or 4 to 6 hours after cholestyramine to reduce the possible interference with the absorption. So sometimes they can, in USMLE, they can ask you this question. Okay, to just memorize this important point. Patients with phenylketonuria should consult the physician before taking Castran Light because that product contains phenylalanine. The following interactions have been noted with the drugs, that is the digitalis, estrogen, progestin, oral diabetic drugs, penicillin G, phenobarbital, spironolactone, tetracycline, thiazide type diuretic pills, thyroid medications, warfarin, leflunomide, and most interactions are due to the risk of decreased absorption of these drugs. So Okay, the other important point, cholesterol may interfere in the absorption of the fat soluble vitamins such as A, D, E, K. Okay, thank you so much for